Welcome to Hidden Health Facts. What if you told me that right now, as you sit here watching this, a clot the size of a grape could be silently forming inside your body, traveling toward your lungs, and within minutes, stopping your ability to breathe. No warning, no buildup, just gone. That is exactly what pulmonary embolism does, and most people have never even heard of it. You feel a little tired. Maybe your heart is beating a bit faster than usual. Perhaps there is a slight shortness of breath. But hey, you have been stressed lately, right? You ignore it. You go about your day, and that decision, that one small moment of dismissal, can cost you your life. This is not a rare disease that only happens to other people. Pulmonary embolism, or PE, kills hundreds of thousands of people every single year. In fact, in the United States alone, it claims more than 100,000 lives annually, more than breast cancer and car accidents combined. And yet, it remains one of the most underdiscussed, underdiagnosed, and misunderstood medical emergencies of our time. Today, on Hidden Health Facts, we are pulling back the curtain on the silent killer lurking in your bloodstream. By the end of this video, you will know exactly what pulmonary embolism is, how it sneaks up on you, who is truly at risk, what the warning signs are that most people completely ignore, and, most importantly, what you can do right now to protect yourself and the people you love. Stay with us. This might be the most important 14 minutes of your life. So what exactly is pulmonary embolism? Let us start at the very beginning. Deep inside your veins, usually in the leg, a clot begins to form. This is called deep vein thrombosis, or DVT. Now on its own, DVT is already dangerous. But the real terror begins when that clot breaks free from the vein wall. It travels through your bloodstream, moves through the heart, and then, it reaches the lungs. It gets lodged in one of the pulmonary arteries. Blood flow is blocked. Oxygen stops reaching your body properly. Your heart begins to strain. And within minutes, your organs start to fail. That is pulmonary embolism. A blood clot in the lung. Silent, fast, and deadly. But here is what makes PE so terrifying. It masquerades as everything else. People mistake it for a panic attack, for asthma, for anxiety, for being out of shape. Doctors in emergency rooms have even misdiagnosed it as pneumonia or a pulled muscle. By the time anyone figures out what is actually happening, it can be too late. And the symptoms, they are almost embarrassingly vague. Sudden shortness of breath, maybe you climbed some stairs. Chest pain, maybe you slept funny. A rapid heartbeat, maybe you had too much coffee. Lightheadedness, maybe you forgot to eat. Each symptom, taken alone, sounds completely harmless. But together, they are your body screaming that something is catastrophically wrong. Now let us talk about who is at risk, because this is where most people make a massive mistake. They assume PE only happens to elderly people, or people who are very sick. Wrong. Completely wrong. Are you someone who sits at a desk for long hours? You are at risk. Have you recently taken a long flight? Even just 4 or 5 hours. You are at risk. Are you on birth control pills or hormone replacement therapy? You are at risk. Have you had surgery recently? You are at risk. Are you pregnant, or did you recently give birth? You are at risk. Do you smoke? Do you have cancer? Are you overweight? Are you dehydrated? You are at risk. PE does not care how old you are. It does not care how healthy you think you are. Young athletes have died from it. New mothers have collapsed from it. Frequent flyers have been struck down on the way home from vacation. Here is a particularly chilling fact that Hidden Health Facts wants you to understand. Roughly, 25% of people who experience a pulmonary embolism have sudden death as their very first symptom. Not shortness of breath first, not chest pain first, death first. There is no second chance, no opportunity to call for help. And what about the people who do survive the first episode? About 30% of them will have another clot within 10 years if they do not take the right steps. The body, once it learns to clot abnormally, can do it again. And the second time is often worse than the first. There is also a condition called chronic thromboembolic pulmonary hypertension, a long-term complication of PE where scar tissue from old clots permanently damages the lung vessels, leading to high blood pressure in the lungs and progressive heart failure. Many survivors of PE live with this for years without knowing what is causing their fatigue, their breathlessness, their inability to do the things they used to love. And yet, nobody is talking about this. Not at dinner tables. Not in schools. Not in workplaces. PE hides in plain sight while people focus on diseases that are far less likely to kill them. But here is where Hidden Health Facts gives you something powerful: knowledge. Because pulmonary embolism, unlike so many killers, is often preventable. And when it is caught in time, it is treatable. Let us talk about what you can do, starting today. First, know the warning signs and take them seriously. If you experience sudden shortness of breath, especially if it comes on quickly and for no obvious reason, do not wait. If you feel sharp chest pain that gets worse when you breathe in, do not assume it is nothing. If your heart is racing, you feel dizzy, or you cough up blood, get to a hospital immediately. Time is everything with PE. Every minute counts. Second, if you have any of the risk factors we discussed, talk to your doctor. Proactively. Ask about your clotting risk. Ask whether you should be on blood thinners during periods of prolonged immobility, after surgery, or during pregnancy. This is not an overreaction. This is smart medicine. Third, move your body. One of the biggest contributors to clot formation is prolonged sitting. If you work at a desk, set a timer to stand and walk every 45 to 60 minutes. On long flights, get up and walk the aisle at least once every hour. Do ankle circles in your seat. Stay hydrated. These small, simple actions genuinely reduce your risk. Fourth, know your family history. Clotting disorders like Factor V Leiden can run in families. If a close relative has had DVT or PE, ask your doctor about getting tested. Knowing you have a genetic predisposition changes everything, and it could save your life. Fifth, if you are already diagnosed with DVT, take it seriously. DVT is the warning siren before the storm. With proper anticoagulation therapy, blood thinners, most cases of DVT can be managed before they become PE. Do not skip your medication. Do not miss your follow-up appointments. That clot in your leg is waiting for a reason to move. And for those who have already experienced a PE, you are not alone, and there is life after this diagnosis. With the right treatment, the right lifestyle changes, and the right medical support, many people go on to live full, healthy lives. Anticoagulation therapy, in many cases, is the difference between a PE that kills and a PE that does not. Let us recap what we have covered today on Hidden Health Facts. Pulmonary embolism is a blood clot in the lungs. It is silent, fast, and deadly. It kills over 100,000 Americans every year, more than breast cancer and car accidents combined. Its symptoms are deceptively mild: shortness of breath, chest pain, rapid heartbeat, and are almost always dismissed as something less serious. It can happen to anyone, young, old, healthy, or not. The risk factors are everywhere, from sitting too long at a desk to taking a long flight to going through pregnancy. And in 25% of cases, sudden death is the first and only symptom. But you now know better. You know the signs. You know the risks. You know what to do. And that knowledge, that awareness, is what saves lives. If this video opened your eyes, do something with that feeling right now. Share this video with someone you care about, because somewhere out there, someone you know is ignoring a symptom they should not be ignoring. Your share might be the thing that saves them. And if you want more hidden health facts that the mainstream never talks about, facts that could change your life or the life of someone you love, subscribe to Hidden Health Facts right now and hit that bell so you never miss a video. We are here every week with the information that matters most. This is Hidden Health Facts. Stay informed. Stay alive.